Okay, welcome everyone. Today we're going to be talking with Dr. Chavez, and she is a pelvic floor therapist, and she's going to be educating us on just the pelvic floor and women's health. So if you are planning on getting pregnant, or in your postpartum era, this is the conversation for you. So, Dr. Chavez, can you just tell us a little bit about yourself and how you got into women's health and pelvic floor therapy?
I'm Dr. Chavez. I am the founder of Ralts Recovery. Prior to having my own practice, I did work for a hospital clinic, and through those 8 years, I learned a lot on how to treat patients with low back pain, hip pain, and just chronic issues that they were dealing with. The population in general was maybe like in their 50s on up, and so there were a lot of cases with back pain that I just couldn't figure out. For the most part, they were able to get better with just the traditional treatments and exercises, but there was a handful of men and women that were just not getting better. So that made me think, is there a missing piece? What am I missing here? And so as I got to know my patients a little bit more, I was able to dig a little bit deeper. And that's when I realized, hey, there's a different area, and it's called the pelvic floor. And luckily at the same time that I was going through this process, there was another therapist that was actually studying to become a pelvic floor therapist. And so that just made things more clear for me, like, oh, let me look more into this pelvic floor. And once I got into that world, I was just amazed at all of the things that can come from that, right? It
Yeah.
has a lot of functions, and it connects to the whole body. So I was just like, wow, let's go ahead and I couldn't treat it at the time because I hadn't taken a course, I wasn't certified, and so I would pass the patients on to this therapist, and they would get better. There were some things that I would do in the hip area because what I learned is that the hip is the pelvic floor. And so some of those things that did help, I was like, wow, I just needed to dig a little bit deeper into these patients' lifestyles.
So you were seeing patients who were 50, 60 years old having back pain, but the real issue was the pelvic floor, and that made you intrigued. So that's interesting. So sometimes there's problems with our pelvic floor, but it's not manifesting in that area. See,
Exactly.
I didn't even know that. Interesting. So then when it comes to pregnancy, postpartum, what's then some diagnosis where you see or women have pain in different areas, but it's actually the pelvic floor. So they may be having problems and they're just thinking, oh, it's back pain, but it's really their pelvic floor. How does that relate to pregnancy?
Yeah, so now with my practice, right, it's been a transition with the patient population. The niche is so much different, and what I've been able to do is treat people on a more preventative side,
Hmm.
having them be more proactive. Now I do have a lot of women that come in after the fact that they've had a baby and now they're having these issues, and so a lot of the you asked me what diagnoses have I seen?
Yeah, or like where does pain manifest in the body? Like how the 50, 60-year-olds were having back pain, but it was pelvic floor. Is it like that with women who are pregnant or in postpartum? Like there's pain somewhere else, but it's really the pelvic floor.
Yeah, so for the most part, a lot of people still, because they're not aware, they still come to me for back pain and hip pain. And
Hmm.
then it's not until they get comfortable with me and or I start to ask the right questions that they start to open up about the pelvic. For the most part, women don't come to me because they have a pelvic floor issue, unless it's because at a workshop, I gave them a questionnaire and they circled it. So yeah, it's still low back pain and hip pain for the most part. And then we dig deeper, and then I ask, aside from this pain, are you having leakage? And they're like, what
Hmm.
is leakage? Like, leaking from where? You pee your pants when you cough, sneeze, laugh, exercise. And they're like, Actually, I do, but I thought that was normal. That's usually how the
Mm,
conversation goes, that they just didn't express it to their doctor or anyone, and they kept it to themselves because they thought it was normal.
okay, okay. And then when is there a difference when you see your patients with women who've had epidurals versus moms who don't get an epidural? Because with the epidural, you get like the Foley catheter, and you don't have that sensation to pee, right? When you have the epidural. Do you see any difference in like pelvic floor issues with those moms?
It would be hard to say because I don't ask that question, like, did you have a catheter or not? But that would be a good question for me to ask from now on. Now that you
Hmm.
mentioned that, but it would be hard for me to know because I don't ask that question. And also, even if they did have a catheter, it wouldn't be the only factor playing a role in how they present afterwards.
Okay.
I guess that ties into the catheter and also the epidural. Like I wouldn't necessarily be able to say, hey, because you got the epidural, your pelvic floor is going to present this way. There's just so many factors that come to play that we haven't even talked about just yet in our conversation right now.
Yeah.
And I'm still learning. I'm still learning. So those two things that you just asked me right now, I'm like, I would be interested to see if maybe for the future patients that do come in, if I
Yeah.
ask them, hey, have you had a catheter? Did you get the epidural? And then see how they present. That would be like a case study.
Right? Like your own little mini study going on. That would be cool to see. Yeah. Okay. And then when it comes to like pelvic floor therapies, right? What I imagine is I'm going in, I'm getting undressed, and you're assessing my pelvic floor. And that may be right or wrong, but can you just walk me through like what a typical visit would look like and feel like?
I like that because it's gonna make women feel a lot more comfortable once they know that it's not as uncomfortable as it may seem. Like when you go to the gynecologist and they're just like, okay, take your pants
Hmm.
off, put this on. It's not like that. And when you come in for a pelvic floor dysfunction, we spend a lot of our time just talking as we are. We spend maybe about 20 minutes. I've had patients who have needed the whole time to just talk
Hmm.
and clear things out. So we go from the initial conversation into the assessment. And the assessment is not right away, hey, remove your pants and get
Hmm.
undressed. No, that doesn't happen. So I take them through, again, a mobility. So we start with their back. We start to look at their hips. We look at flexibility. We look at strength. We look at balance, just like any other evaluation on the first day. So we go from there. Why? Because what I've realized as a pelvic floor therapist is that the pelvic floor is the hip. It's just a deeper layer of it. And
Hmm.
so if you are having some stiffness or weakness or tightness around the hip, we have to unlock those areas first
Hmm.
before we get deeper into that area. And what I've realized is that a lot of times, just by doing that or just by providing education, like quick wins through education, like, hey, try this tip at home, the patient's already getting better. Like, I've had patients after the first visit
Yeah.
report back that they're no longer leaking or they're no longer running to the restroom because they
Hmm.
have an urge to pee. But that comes down to the education that was provided and the clarity that they get after that first visit. And so internally, we don't really go internally
Hmm.
unless everything else is already unlocked. It's not as tight, it's already strong, and we're still having issues. Then, like the second, third, even fourth visit, I'm like, hey, it's time for me to check your muscles internally. This is what it's going to look like. It's not going to be painful. Are you okay with that? The patient has the option of saying yes or no. If they say no, there's still a lot of work that I can do very close to the area
Huh?
that can help the patient out.
Yeah, that's good to know because I feel like a lot of people are just like, "Ooh, I don't want anybody touching or seeing me, so let's not go see a pelvic floor therapist," right? And I love that you just clarified that, hey, there's lots of things that we could do, and most of the times we're just dressed. And you talked about like hip mobility, right? And I'm a doula, so that's big in my world, navigating the pelvis, helping the baby to come down. Would you say it would be great if moms started seeing that pelvic floor therapist even before they got pregnant, or come see you when they are pregnant and trying to get ready for birth?
Yes, even before, right? Like, so that's my vision and my goal right now is to spread awareness that you don't just have to come after, like you can prepare your body for birth with pelvic floor therapy.
Yeah, yeah. And when it comes to preparing for birth, right? What are some things that you do with moms who are pregnant, and like what area of the birthing process does pelvic floor therapy play a role?
Yeah, so most importantly, in the down regulation, a lot of the moms are nervous.
Mm,
And so we teach them how to de-stress. We target the nervous system, and our environment that we have here at Ralts Recovery is meant for them to quiet the outside noise. You come in and you're going to relax. And so we target a lot of that. We do a lot of diaphragmatic breathing. We combine a lot of our stretches with diaphragmatic breathing. I also want to clarify that nothing that we do here is painful. So whether it's external or internal, everything is done very gentle because we keep in mind that the women have already been through a lot of trauma, whether physically, mentally, just everyday stress. It builds up in the pelvic floor, just like the tension that we build up in your shoulders is the same kind of tension that we experience inside of the pelvic floor. So we keep those things in mind, and that already in itself is helping to prepare the woman for birth, right? So we massage a lot of the back muscles around the
mhm,
glutes, the inner thigh area to make sure that the woman during labor she can open and close her legs. We also educate on birthing positions, right? The traditional way of like laying on your back with your knees apart. We understand that that actually closes the pelvic floor, but with your
mhm.
knees together, feet out, it actually opens up the pelvis. When I learned that, I was like, wow, no
Right? I
wonder
was
a lot of
like,
people are something so simple like that, right?
yes.
And I understand that a lot of people have their own opinions based on their backgrounds, and a lot of maybe hospital people may not understand that. And so I have had women say, well, my nurses have said that it's okay for me to just have the baby like this. And I'm like, yeah, but you can be an advocate for yourself, and that's why
Exactly.
you do what
Yeah.
you do as a doula, because what we don't know will hurt us.
Yeah. Yeah.
And I want to
Yeah.
make that better in general.
Yeah, yeah, and I totally get what you're saying because like I'm not an old school nurse, but I've been a nurse for 13 years, right? And when I started, because I'm a nurse and a doula, so when I started nursing, I didn't know about the different ways. Like they didn't teach me about the pelvis in nursing school and the muscles and all the things and just bringing your knees together and how that opens up the bottom of the pelvis, right? And if you are not a proactive nurse and going out there and doing all the education and adding knowledge, then you just don't know these things, right? And that's why I love that I became a doula because I know those things because I became a doula, right? And so happy for you and the education and knowledge that you're bringing into this world with your specialty.
So even as the patient is breathing, right? Something so simple as diaphragmatic breathing. As you inhale, the pelvic floor muscles are actually stretching outward. And
Mm,
then as you exhale, the pelvic floor muscles are coming back to support the organs. So there's
interesting.
something physiologically also happening as they're breathing. So we're not just down, we're like, I try to pick things that will benefit the women in the most effective way by doing some.
Yeah. Yes. Well, thank you for all the education and knowledge that you've given us today. How can people find you, Dr. Chavez? Where are you located? What's your social media? How can people connect with you? Okay, nice. I love it. Thank you so much for joining me today. And I hope our listeners gain knowledge from this. And I hope they come out and support you, your business, and get the help that they need. You're welcome. Yay!